Hey guys, I'm Dr. Trey Martin at Pursuit Physical Therapy. Today I want to go over a case presentation that I had in the clinic a few months back. So just to set the scene a little bit for you here, I had an elite level, high D1 college female runner. So she's doing 50 to 70 miles a week, really high workload. So she came to me presenting with shin pain on the left lateral side of her shin. It had been going on for a few months, about 6 to 7 months at this point. She had tried things like foam rolling her calf, Graston work, calf stretches. She had treated it like shin splints the whole time, and as did her college training staff and a previous therapist she went to. So she had been treating it like it was actually shin pain. So the interesting part of the story is when we did the evaluation, she reported findings here, but she also keyed me in on a little bit of a diffuse, sometimes kind of IT band pattern. So this interested me, so I started looking into the lumbar spine in this case scenario. So one of the interesting things that you can see is the lumbar spine itself can give you a referral pattern, and it gives you a pain presentation where you think your pain is actually here, but it's really coming from the back. So to explain this a little bit more, with this runner, what I saw was she didn't have very good hip extension during her stride, and she also did not have a ton of glute strength, so she couldn't stabilize and control the motion. So what happened was, instead of getting true hip extension through the hip joint, she had to arch back in the lumbar spine. And then you add in 5-10 miles at a time, running at a really high level and pounding the pavement, and she was getting a little bit of compression along L5 here, and it was giving her a distribution pattern here. So we started treating it as a back issue, and we started correcting her hip extension. We did some other things like addressing hypertonicity in the quadratus lumborum muscle here, and that really helped clean it up. And then we layered that in with a little bit of hip strengthening, and that improved her symptoms dramatically. So moral of the story is this: it's not necessarily where you feel the pain. At times, the lumbar spine can give you a mistaken pain pattern that's actually coming from your back and not your shin. So if you've been failing treatment for shin splints, and this sounds like you, and you haven't really got a good answer, a good root cause of why you're having shin pain, then I would love to talk to you more about this. You can comment below and just say, hey, this is me, this is something I've been dealing with. And you may need a thorough physical therapy evaluation to make sure it's not actually coming from the lumbar spine, or if it is, it's something that's treatable, as we mentioned today. So again, if you have any more questions and you want to see more patient case studies from us, go to pursuitphysicaltherapy.com, and you can check us out on the website. Thanks for tuning in, and I hope you guys enjoyed this and got a little bit out of this today.